12 mistakes people make before blood tests and how to fix them. Most people think blood tests are simple. The doctor orders them, you show up, get poked, and go home. But here's the surprising truth almost no one talks about. Your actions before the blood draw can completely change your results. A single mistake, like drinking flavored coffee, skipping medication, or even taking the wrong supplements, can lead to misleading numbers, and sometimes even the wrong diagnosis. So in today's video from Live Healthy Every Day, we're diving into the 12 most common mistakes people make before blood tests, why these mistakes matter, and what you must do instead to make sure your results are accurate and trustworthy. Let's get started. Mistake number 1. Not fasting correctly. Many people think fasting means avoiding food, but they drink coffee, tea, lemon water, chew gum, or even take flavored vitamin water. But here's the catch. Anything with flavor, even without calories, can stimulate insulin and adrenaline, throwing off fasting glucose, insulin, and triglycerides. Fix: only drink plain water for 6 to 8 hours before fasting labs. Nothing else. Mistake number 2. Skipping your essential medications. Some people avoid taking daily medications, thyroid pills, antidepressants, anti-seizure meds, thinking it will make their results more clean. But missing a single dose can distort your lab values. For example, skipping levothyroxine can falsely lower your TSH and make it look like your thyroid is failing again. Fix: ask your doctor which meds to take or pause. When in doubt, bring your medication list to the lab. Mistake number 3. Getting blood tests. While sick or exhausted, even a mild cold or a poor night of sleep can raise your white blood cells, ferritin, CRP, ESR, cortisol, and even blood sugar. Doctors often see people accidentally misdiagnosed because they tested while their immune system was under stress. Fix: if you feel off, reschedule your blood work 5 to 7 days later. Mistake number 4. Taking supplements that alter lab results. Many people assume supplements are harmless, but some dramatically alter blood tests. Biotin disrupts thyroid tests and heart markers. Ashwagandha and rhodiola affect cortisol. Too much vitamin D raises calcium. Zinc and copper imbalance iron markers. Fix: stop supplements 2 to 3 days before testing. High-dose biotin, 5,000 plus mcg. Stop at least 72 hours. Mistake number 5. Being dehydrated. Lack of hydration concentrates your blood, making it thick and harder to draw, and it can falsely elevate BUN, creatinine, sodium, and hemoglobin. Fix: drink plenty of water the day before. On the morning of the test, drink about 16 ounces, 500 milliliters of water, 20 to 30 minutes beforehand. Mistake number 6. Not reporting online medications or wellness clinic treatments. This one happens more than you think. People take testosterone, compounded thyroid meds, peptides, or weight loss injections without telling their doctor. These substances drastically change labs. For instance, testosterone often pushes red blood cells and hemoglobin so high that it can look like a blood cancer. Fix: list everything you take, even if it seems irrelevant. Mistake number 7. Exercising right before your blood test. Morning workouts spike creatinine, CK, liver enzymes, glucose, and cortisol. Doctors may interpret this as kidney damage, liver disease, or even diabetes. Fix: skip intense exercise. Light walking is okay, but save the heavy workout for later. Mistake number 8. Eating a heavy, fatty meal the night before. Even if you fast afterward, a high-fat dinner can bump up your cholesterol and triglycerides for many hours. Fix: choose a lighter dinner, moderate protein, moderate carbs, low fat. Mistake number 9. Testing too soon, after starting or changing medications. People excited to see progress often test too early, especially with thyroid medicines or statins. But your body needs 6 to 8 weeks to fully respond. Fix: follow your doctor's timing guidelines. Testing too soon will only show misleading numbers. Mistake number 10. Doing blood work 1 day before your appointment. When tests are done too close to your visit, results may not be ready. Your doctor then has no data to discuss, which delays treatment. Fix. Do labs 5 to 7 days before your appointment. Mistake number 11, getting blood tests. After a night of poor sleep, this mistake often goes unnoticed. A restless night raises cortisol, glucose, inflammatory markers, and even blood pressure. All of these can distort your lab profile and send your doctor down the wrong path. Fix. Prioritize sleep the night before. Aim for at least 7 hours. Mistake 112. Feeling stressed, rushed, or anxious. Before the draw, emotional stress increases adrenaline and cortisol. This can raise your glucose, skew hormone levels, and even elevate white blood cells. You'd be surprised how many people look abnormal on paper simply because they rushed into their appointment after traffic or work stress. Hidden factors that distort your blood test results. What most people never realize. Most people think preparing for a blood test is only about fasting and avoiding coffee. But there is a whole list of less obvious behaviors and lifestyle habits that quietly alter your results without you noticing. These habits can make your numbers look higher or lower than they actually are, leading to unnecessary anxiety or even incorrect treatments. Understanding these subtle factors is just as important as avoiding the major mistakes discussed earlier. One of the most underestimated influences is your stress level over the previous 48 hours, not just the morning of the test. When your body is overwhelmed by stress, whether from work deadlines, family problems, lack of sleep, or even traveling, your adrenal glands pump cortisol and adrenaline into your bloodstream. These hormones raise blood sugar, elevate white blood cells, and can even shift your thyroid readings. Many people believe their lab report shows inflammation or thyroid imbalance, when in reality their body was simply reacting to psychological pressure. Another overlooked factor is your eating pattern in the days leading up to the test. Even if you fast for 8 hours, your diet over the previous 2 or 3 days shapes your triglycerides, liver enzymes, uric acid, and glucose regulation. One weekend filled with processed food, excessive salt, sugary snacks, alcohol, and fatty dishes will show up in your blood work. That's why some people see perfect results one month and terrible numbers the next, even though nothing major changed in their routine. The real cause is short-term diet fluctuation. Preparing properly for accurate results actually starts 2 to 3 days before your appointment, not just the night before. Another hidden mistake is taking over-the-counter pain relievers too close to your test. Medications like ibuprofen, naproxen, and aspirin can temporarily alter kidney function markers, liver enzymes, platelet count, and clotting time. Even a single pill can cause mild shifts. This is especially important for anyone being monitored for kidney disease or liver conditions. A common scenario is someone taking a painkiller for a headache the night before the test and then being told their liver enzymes are elevated. The numbers often return to normal once the medication is cleared from the system. Alcohol consumption also plays a major role. Many people assume a single glass of wine or beer won't matter, but alcohol affects glucose, triglycerides, liver enzymes, inflammation markers, and even hydration levels. It can take 24 to 72 hours for some levels to return to normal, depending on the amount consumed. Someone who drinks socially on weekends may unknowingly cause their Monday morning lab results to look much worse than they truly are. For anyone monitoring prediabetes, liver health, or metabolic syndrome, avoiding alcohol for 48 to 72 hours before testing is one of the easiest ways to obtain accurate numbers. Another subtle factor is your menstrual cycle, which significantly affects iron, ferritin, and hemoglobin levels. Many women are told they have low iron, but they had blood drawn during or shortly after their period. Hormonal fluctuations during different cycle phases can also alter thyroid panels, estrogen, progesterone, and even inflammatory markers. Tracking the timing of your cycle and letting your doctor know where you are in the month can help them interpret results more accurately. Next, consider how hydration throughout the entire week influences your labs, not just the morning of the test. Chronic mild dehydration concentrates your blood, raising sodium, chloride, hemoglobin, hematocrit, and BUN. People who exercise frequently, drink little water, or consume lots of coffee and salty foods often have skewed numbers for days at a time. Increasing water intake gradually over several days is far more effective than trying to drink a large amount only on the morning of the test. Another mistake people rarely think about is the timing of their supplements or medications relative to the test. Even supplements that are safe to continue might temporarily spike levels if taken right before the blood draw. For instance, taking a multivitamin in the morning can raise your B12 or folate levels to artificially high numbers that don't reflect your true baseline. This doesn't mean you should stop essential supplements. It simply means taking them after your appointment instead of right before can make your results more accurate. Exposure to extreme temperatures, hot weather, saunas, steam rooms, or even intense cold can also subtly affect your blood results. Heat increases dehydration and causes shifts in electrolyte balance, while cold exposure influences cortisol and blood pressure. People who regularly use saunas or ice baths should avoid these activities 12 to 24 hours before their test to prevent unusual fluctuations. Another essential yet forgotten factor is how long you've been sitting or standing before your blood is drawn. Standing for long periods pools blood in your lower body, raising hemoglobin and hematocrit levels. Sitting quietly for at least 5-10 minutes before your blood draw allows your cardiovascular system to stabilize. Small details like this often explain why people see inconsistent results from one test to another. Caffeine withdrawal is another surprising disruptor. If you normally drink coffee every morning but skip it suddenly for your fasting test, the stress and withdrawal symptoms, like headache, irritability, and fatigue, can elevate cortisol and adrenaline. This can lead to altered glucose and inflammatory markers. A smoother approach is to reduce caffeine slightly the day before and then avoid it entirely during the fasting period. Finally, one of the most important but underrated factors is the time of day you get tested. Hormones like cortisol, testosterone, and thyroid levels fluctuate naturally throughout the day. Glucose tolerance also changes between morning and afternoon. For the most consistent, medically reliable results, early morning testing is generally best. If you test at different times each visit, your numbers may vary even when nothing else has changed. When all of these hidden influences are combined with the major mistakes discussed earlier, it becomes clear why so many people receive lab results that don't match how they actually feel. By managing these subtle but powerful factors, you're not only giving your doctor a clearer picture, you're giving yourself the most accurate insight into your health. Silent factors that distort your blood test results without you realizing. Many people believe that fasting, skipping coffee, and getting a full night's sleep are all it takes to get accurate blood test results. But in reality, there are far more biological, environmental, and lifestyle factors that quietly shift your numbers, even when you think you've prepared perfectly. These hidden influences don't just nudge your results up or down. Sometimes they mimic liver issues, thyroid problems, kidney dysfunction, or metabolic disorders. One of the most overlooked factors is your circadian rhythm. Your body runs on a 24-hour cycle, and many hormones rise and fall dramatically throughout the day. Cortisol can be twice as high in the morning as it is at night. Testosterone peaks when you wake up. TSH rises at night and slowly declines toward morning. If you get tested at different times each visit, these natural fluctuations can easily be mistaken for disease. For anyone monitoring thyroid hormones, sex hormones, glucose, or cortisol, testing at the same time of day each time is nearly mandatory. Another major disruptor is chronic sleep loss, even if you're not pulling all-nighters. Just 2 or 3 nights of sleeping only 4 or 5 hours can elevate CRP, boost cortisol, raise fasting glucose, and impair insulin function. Studies show that sleep deprivation can make lab results look like you're dealing with inflammation or prediabetes, even when you're not. Poor sleep also affects how your liver processes lipids, temporarily raising triglycerides and cholesterol. This is why many people panic when their results suddenly look worse, even though their diet hasn't changed. Next comes iron storage and muscle metabolism, which are significantly affected by your workouts in the days before testing. People who lift heavy, do high-intensity cardio, or train intensely often see temporary increases in ferritin, CK, and liver enzymes. This doesn't mean liver damage or muscle breakdown. It's simply the body repairing itself after intense exercise. But without understanding this, those elevated numbers may lead doctors to suspect liver disease, muscle disorders, or systemic inflammation. Energy drinks, caffeinated beverages, and foods containing taurine or niacin are also culprits. Even if you don't drink coffee, hidden caffeine in bottled teas or energy drinks can alter blood sugar, electrolytes, liver enzymes, and even heart rate. Many people unknowingly consume these the night before a test and end up with results that look inaccurate or alarming. Extreme dieting or long fasting windows also distort your results. When you fast for 16 to 24 hours or follow a strict low-carb diet, your body shifts into ketone production. This can lower glucose, temporarily raise triglycerides, alter thyroid hormones like free T3, and elevate BUN or creatinine because your body is breaking down more protein. For people unaccustomed to fasting, even skipping one meal can cause your liver to dump extra glucose into your bloodstream, making your fasting numbers look artificially high. Environmental chemicals are another silent influence. Things like solvents, strong cleaning agents, paint fumes, or secondhand smoke within 24 to 72 hours of testing. These exposures can elevate liver enzymes, affect red blood cells, or even alter thyroid hormone levels. People working in construction, renovation, or chemical-heavy environments often see unpredictable lab fluctuations without knowing why. Even mild injuries, strained muscles, back pain, joint misalignment, or tendon irritation can raise CRP and ESR. Doctors often use these markers to diagnose autoimmune or inflammatory diseases, which can lead to mistaken suspicions when the true cause is simply localized inflammation from an everyday injury. Another overlooked factor is donating blood shortly before testing. Hemoglobin, hematocrit, and ferritin can drop dramatically within 24-72 hours after donating. If you get tested during this window, the results may incorrectly suggest anemia or iron deficiency. Because your body needs several days to rebuild blood volume, it's best to wait 1 to 2 weeks after donating before getting tested. Even your body position right before your blood draw affects results. Standing too long increases red blood cells, sodium, protein, and albumin because fluids shift downward. Sitting calmly for at least 5 to 10 minutes ensures more stable and accurate readings. Finally, it's important to remember that every lab value has a natural range of daily variation. A small difference isn't always a medical problem, but when multiple factors, poor sleep, stress, irregular eating, intense workouts, overlap, your results can become significantly distorted. Preparing properly for 48 to 72 hours before your test is the best way to ensure reliable data and help your doctor make accurate decisions about your health. A surprisingly common cause of inaccurate blood test results is fluid retention, bloating, or eating high-sodium meals within 24 hours of your appointment. When your body holds onto excess water or sodium, the balance between plasma and blood cells shifts. This can alter sodium, potassium, BUN, creatinine, and even liver enzymes. Many people eat hot pot, barbecue, fast food, or salty snacks the night before and wake up shocked by abnormal results. Often, it's not disease. It's simply temporary water imbalance. Sugar and fructose are equally problematic. Eating too much dessert, bubble tea, soda, or very ripe fruit the night before forces your liver to work overtime. This raises fasting glucose and disrupts lipid metabolism the next morning. As a result, people are frequently told they may be pre-diabetic or insulin resistant, even if their metabolic health is actually much better than the numbers suggest. Herbal drinks are another source of confusion. Ginger tea, turmeric tea, chamomile, detox blends, and homemade healthy drinks may seem harmless, but depending on your body chemistry, they can influence liver enzymes, kidney function, electrolytes, or hormones. Turmeric may affect bilirubin, ginger can influence clotting. Diuretic herbs may alter sodium and potassium. Drinking large amounts shortly before a test can throw off your numbers. People on weight loss plans or detox diets often face similar issues. Extended intermittent fasting, juice detoxes, or drastic calorie cuts put the body under stress, increasing cortisol and causing glucose swings. Lab results may resemble chronic stress or metabolic dysfunction, and for those monitoring liver or kidney health, sudden increases in fructose from juice detoxes can temporarily shift liver enzyme levels. Traveling or changing time zones also disrupts your hormones and metabolism for several days. When your circadian rhythm is thrown off, cortisol, insulin, glucose, and TSH can fluctuate sharply. If you've recently flown long distances or experienced jet lag, it's best to wait 48 to 72 hours before testing to restore your internal balance. Emotional state plays a major role too. Even if you don't feel stressed, chronic mental tension increases adrenaline and cortisol, raising blood sugar, lipids, white blood cells, and inflammation markers. These shifts can mimic infections or endocrine disorders on your lab report. On the opposite extreme, excitement or overstimulation, like staying up late for a party, concert, or sporting event, also affects hormone balance, heart rate, and glucose. These effects can persist well into the next morning. Water quality is another subtle factor. Drinking mineral-rich water, alkaline water, or high electrolyte bottled water can slightly alter sodium, magnesium, calcium, or bicarbonate levels. The changes aren't dangerous, but doctors may misinterpret them if they don't know about your hydration habits. Mild dehydration from hot weather, sweating, or dry air conditioning thickens your blood, pushing up creatinine, B1, hemoglobin, and hematocrit. This is especially common among older adults and people who exercise frequently. Finally, the emotional tension at the clinic itself affects your results. Many people feel anxious or nervous around needles. That immediate spike in adrenaline can raise heart rate, blood pressure, and blood glucose within minutes. This is why medical staff often ask you to sit quietly for 5 to 10 minutes before your blood draw, to let your body settle back to baseline. Preparing thoughtfully for your test doesn't just ensure more accurate results, it also protects you from unnecessary worry or incorrect diagnoses. When you understand these everyday influences, you can interpret your results with confidence and avoid the common misunderstandings that so many people experience. If you found these insights valuable and want more science-based guidance on improving your lab results and protecting your long-term health, make sure you subscribe to Live Healthy every day. Leave a comment with topics you want us to break down next and follow the channel so you never miss a new video. Your health deserves clarity, and we're here to help you understand it, one video at a time.